Hi, it's Kat with Orion Billing. I make videos to help those doing medical billing to better understand the job and get more money in the door. I thought I would talk a little bit about what the job is, what do and what should medical billers do. I recently came across someone who thought they had a medical biller taking care of things, only to find that all the biller was really doing was clicking the buttons to submit the claims and clicking buttons to accept the payments automatically into the software. And that is not all there is to the job. So I wanted to talk about what it is that a medical biller should be doing. So the first step is to ensure there is a thorough verification of benefits done. That means that a patient provides their insurance information and we find out what their benefits are, what their policy covers, how much is going to be covered, how much the patient might end up owing, and then be able to explain that to the patient. The insurance companies don't guarantee that the benefits they quote in a verification are correct, and so we also in turn cannot guarantee the benefits information we provide to the patient, but it's usually pretty accurate. The claims that are sent to the insurance company belong to the patient. They're not the provider's claims, they're not the clinic's claims, they're the patient's claims. The medical office only submits claims to insurance companies as a courtesy to the patient and accept assignment, meaning we say we will send in your claims and we will receive payment from the insurance directly as a courtesy so that the patient doesn't have to pay up front and wait for reimbursement from the insurance company. Some practices do operate that way. They'll help patients maybe submit their claims, but they do get paid up front. In any case, the point being that the patient does owe what the insurance company says that they owe. And ideally, there would be someone there in person able to even briefly explain their benefits to the patient. So it may fall on the remote biller to help the office understand the insurance so that they can do that, or to help the patient understand their own insurance. People often don't understand their own insurance. It's not uncommon. There might also be pre-authorizations needed or pre-certification needed depending on the insurance. So that would need to be submitted to the insurance company and get pre-approvals for whatever the treatment is if they're needed also. The insurance verification is a really important step no matter who's doing it. Often it can be done in the office by the front desk, and perhaps the medical biller is not the one doing the insurance verification, but it is wise for a biller to make sure that it's being done well. Otherwise, you may end up submitting a whole lot of claims for a practitioner that are not going to get paid, and the patient may end up owing more than expected. It can get messy. The next thing that needs to happen is patient demographic entry into the software. That's just the patient's name, address, date of birth, the primary policyholder information, so that all of that populates correctly on the medical claims and matches what the insurance company has in their computer for this patient. It's very easy for the office or the front desk to do this patient demographic entry. I would just recommend that the biller double checks and makes sure that the information is correct and complete with no typos and nothing missing, just so that the claims don't get rejected for missing simple information. So then the patient sees the practitioner, and the next thing that happens is the coding and charge entry. Every patient encounter needs procedure codes and diagnosis codes. The procedure codes, or CPT codes, show what the doctor did, and the diagnosis codes, or ICD codes, show basically the reason why the doctor did those procedures. Again, these days with technology, and especially with something like chiropractic or physical therapy, where the codes used are pretty limited, so it's pretty easy for a practitioner to enter the codes and charges into the software. In some cases or in some settings, it could be that the practitioner will make notes, and then a coder would then need to translate those notes into codes. But most commonly, especially in the fields I work in, the practitioner may enter their codes and charges into the software. So then the biller then takes that information and does the claim submission. And this is the electronic processing where you send the claims electronically through to the clearinghouse, which is a sort of electronic station that exchanges information back and forth with insurance companies. And from there, they go to the insurance company. That process is all very automated, but it is also very wise for a biller to look at the claims before they leave the building, check the codes, look for things missing, mistakes. If anything looks off or unusual, get questions answered about them before being submitted. This is where the biller reviews claims and sends them out. So the insurance company will receive and process those claims and then respond with their remittance information. And the biller is responsible for entering that information into the software, which can be done automatically, but that means basically bringing the electronic data into the software and then reviewing it to make sure it is going in correctly. And this is where you start to see where some of the problems are, what might not be covered, what's unpaid entirely. You'll see all the variables, what the denials and problems are. It is important to keep this remittance posting up to date because this is how the provider knows what's happening with the patient's coverage. Which brings us to the next part of the job, which is the follow-up. And this is, I would say, the biggest and most important part of the job, which tends to be most neglected from what I would personally say, having taken over billing from practices where some other person or company has been doing it previously. If it really was just pushing the buttons to submit claims and receive payments, anybody could do it. It would never get messy. Everything would be paid as it should be, and there would really be no need to have a medical biller. But it is the medical biller's job to do the follow-up, to keep up with the accounts receivable. Insurance is unfortunately a very imperfect world, and in order for a practice to get payment on all of their claims and not lose lots of money, the biller needs to tackle things like denials, insurance requests for more information or refunds, any of the variables the insurance companies throw at you. The biller needs to sort through all of that and fight it or figure it out and respond. In that process, there's a lot of communication that happens with the insurance companies, perhaps with the provider, their staff. Depending then also on the practice, the biller may do the patient billing. Once the insurance companies have responded to claims, there may be amounts that were not collected at the front desk for whatever reason, and the patient will need to get bills so that they can pay what they have to pay. Patients may have questions about why they owe those amounts. So there may be communication with the patients to help explain that. And it may also be needed because, some patients, they go into the office and they see the front desk person. So it's a good idea to help that person understand the issue if there's an issue so that they can explain it to the patients as well. And then finally, there is reporting. And this is just where you create reports to show what was billed out, what was paid. Using reports, you can see how healthy the accounts receivable is, what needs attention, or what the biller is in the process of working on. This is really valuable information for a practice owner in managing the practice, and it also shows what you're doing or not doing as the biller. It can help the practice to see what's going on, and if they get reports once or twice a month, that can be really helpful to them. So that is a very basic overview of what the job of a medical biller is and what a medical biller does. I hope that's helpful. Have an awesome day.